think the Enough for All strategy itself has several strengths. First of all, it was grounded in evidence-based practices for reducing poverty. So the 10 levers of change come from research that argues if you're going to move the needle on poverty and have true impact, you need to focus on game changers. And that is what the levers are. So financial empowerment, health, housing, transportation, early learning, employment, etc. Organizations and strategies that collectively focus on these 10 levers will lead to poverty reduction. Second, poverty reduction requires a citywide strategy. The Enough for All strategy is not about one organization. Measuring progress of just VCC cannot and will not capture the fulsome picture of great work that's being done in our city. So one organization could not possibly reduce poverty or support all 10 of the levers in the strategy, the 3 goals and the 9 principles. Third, I would say the original strategy was developed over several months with multiple organizations and partners, and every year has been evaluated to look for areas of strength and areas for growth. After a few years of learnings, the strategy was refreshed and updated using what we'd learned. And one of the consistent learnings year after year is that poverty is not just about income, it's about inclusion, and it's about dealing with trauma. This is really complex work that takes time. It takes persistence and patience. And having one organization, in this case, VCC as the backbone, means we have greater consistency, increases opportunities to build capacity and momentum over several years. So to reduce poverty, though, we have to change the systems, the practice, and the policies that either facilitate growth, healing, and inclusion, or exacerbate trauma. So all of these sort of ideas take multiple partners. So in the Enough for All evaluation, we are evaluating the impact of the strategy. So are we moving the needle on poverty reduction, and the processes, or the process that is happening in our city to reduce poverty. So this includes partnerships, relationships, and the role of VCC as the backbone. So there are multiple pieces to the evaluation. We have an evaluation advisory committee that helps oversee all of the work and the process that we go through to collect information and to develop our annual reporting practices. So the committee includes leaders, research, data, or evaluation experts from each of the MOA partners and a lived experience expert. So again, because what we're evaluating is a complex citywide strategy, the feedback and input from this committee is invaluable. There are lots of moving parts and lots of context and environmental factors that we have to consider each year, and that we have to reflect as fulsomely as possible in terms of the whole picture of what's happening in our city. The advisory committee helps develop the interview and survey tools, the external data points that we need to look at, including employment numbers, income support caseloads, etc. In addition to the advisory committee that includes the MOA partners, we also consult with Poverty Talks and the Indigenous Advisory Committee every year, and they help guide us through the key issues and potential solutions that we should be focusing on. We also try to engage each of the champions who've signed on to support the strategy to capture the work that they're doing and how their work is impacting poverty. All of this is pulled together to help us tell the story of the impact of Enough for All. We do include questions about VCC's effectiveness, so we can assure we are continuing to build backbone capacity as things shift and change in our community. The Indigenous Advisory Committee reminds us that there are multiple ways of knowing, and that the Enough for All strategy and the evaluation has to be meaningful and relevant if we're going to make a difference. We include a realist approach to data collection, which means we work collectively, we work in partnership, and we listen to multiple voices and perspectives. Representing the results of the evaluation is more than just a written report, and an oral report respects traditional ways of knowledge sharing. COVID-19 meant we were limited in ways to engage this past year in 2021, but we fully intend to revisit the discussion with the advisory committees this year and come up with alternative approaches to sharing our learnings, including potentially an oral representation. I think one of the value adds for having a narrative piece included is you get to hear multiple voices and see different people and hear their personal perspectives on how they think we're doing. And so the written report, is primarily written by me in partnership with the advisory committee, but the oral representation includes the voices of members of the Indigenous Advisory Committee. And so they get to share from their perspectives, the particular pieces that are really important, the things that we need to pay attention to, and I think the highlights and the strengths of the work. So it includes multiple voices and multiple perspectives, which I think is really important. In 2021, we really felt it was important to add a component to our evaluation, which was engaging with lived experience experts in terms of how the pandemic was impacting their lives, their employment, their personal lives, their health, their wellness. And so we added a survey and distributed it through the MOA Partners networks. It included questions about what has happened in your life because of the pandemic, what has changed, how are you coping? We learned really valuable information about some of the enhanced difficulties that people were facing. So this is information we wouldn't have captured in our sort of typical data collection methods for the evaluation. And we heard stories of people having to make some very difficult decisions about how to spend their money, including only taking their medications every 2 or 3 days, eating 1 meal a day, turning the heat down, during a cold snap. And so, these are stories that probably people grapple with all the time in our city in terms of living in low income and living in poverty. But the issues did seem to be really exacerbated by the pandemic. And so after we did our surveys, we booked some group interviews with lived experience experts as well to just get a little bit more context. And what we heard was that the health and wellness of people was particularly impacted. And a lot of people in our city were really struggling in ways that we hadn't seen or heard before. So I think one of the things we really struggled with in our last year's evaluation was engaging with people, getting people's feedback, collecting information as fulsomely as we could. And there's obvious reasons for that. The pandemic, people in the not-for-profit sector and many of our partners were working full on to just respond to the crisis of the pandemic, keeping services running, moving to virtual formats, alternative formats to keep people engaged, in some cases struggling with threats to funding cuts or actual funding cuts, changes to policy with emergency benefits. So I think a lot of our partners were really scrambling to just stay in front of things to make sure they could be connected to people in their programs and keep people coming in. And so obviously that limits their time and capacity to engage in research, for example. So my hope moving forward is that we find ways to meaningfully engage our champions in these conversations around the evaluation. Their feedback and their input is invaluable in terms of, we know there's fantastic work happening in our community, and we really want to shine a light on it. We really want to create a platform for champions to share what they're doing, to share their learnings, and also to help us learn what we need to do differently and how we need to better engage, find the gaps that we need to fill, find creative solutions in this sort of new reality that we're working with now. So I think if I could reach out and send a message to our champions, it would be help us find ways to engage with you in ways that are respectful of your time. We can be flexible in how we talk with you, learn from you, and we really want to do that because we know you're doing fantastic work and we really want to be able to capture it. I think, the gift that we have in this evaluation is that we've done it for multiple years. And I think one of the strengths of this particular evaluation are the partnerships, and having that sort of consistent BCC as a backbone, consistent support from the MOA partners means that we have many years of learning and many opportunities to build on those learnings and take up the recommendations that come from the evaluation and find solutions. And so I think that's a good surprise, really, because it's not often that you get many years of consistent reporting and consistent partnership building, which is critical for this work. In terms of other things that surprised me, I think our engagement with lived experience experts really added a level and a layer to what we know about poverty and the impact of poverty on our city that we haven't fulsomely heard before. And so we talked with over 200 people this past year who are grappling with many, many things. And the depth of the struggles was surprising, but also the resiliency and the strength in terms of how many people are just finding ways to work through this, one foot in front of the other, consistently seeking out solutions, consistently working to find ways to, to find solutions and to find ways to deal with the struggles. That is always very humbling and very surprising to me when you know how difficult life can be for some people and how hard they have to work to keep moving forward. I think we're seeing phenomenal progress in areas like financial empowerment. Year after year, more and more families, more and more individuals are accessing financial coaching, tax clinics, matched savings programs, RESPs for their kids. And all of these are meant to build income and assets and reduce debt. And Calgary is leading the country in many of these initiatives. So this is a huge success for us. I think policy changes that we've seen at the city, including the sliding scale transit passes, where the fee for your transit pass is based on your income. This means that some Calgarians can get a monthly bus pass for as low as $5. The fair entry program with the city is used by tens of thousands of Calgarians who get reduced rates for many city programs, including things like swimming lessons. So not only does this increase access for families, it frees up income for other things. And survey data administered by the city shows that almost 100% of people who access these programs believe their lives are better because of them. So that's a really important strength and accomplishment. More than 100,000 people are accessing community hubs in their own neighborhoods. They're being supported to access programs and finding ways to build connections in their community. And I think another really important accomplishment is VCC's role in policy change. And so VCC is part of a community collaborative that's actively working to change policy. 100% of people that we surveyed in terms of VCC's effectiveness and their role said that VCC is definitely influencing policy change. And this is how you reduce poverty, by focusing on changing systems and changing policies. These are just fantastic accomplishments and really just a small snapshot of the great work that's being done. In terms of areas that need growth, I'm concerned about keeping momentum moving forward towards reconciliation. There are organizations actively working in this space, but not as many as we had hoped. I think this will be critical moving forward in terms of VCC's role and being really clear in what is their work in building community-wide support for enhanced efforts towards partnership, healing, and reconciliation. I think we may be facing some tough times regarding funding in the not-for-profit sector. The pandemic has created government debt, and my concern is that decision makers may be looking for ways to cut costs. This is a dangerous strategy in a time when support is so desperately needed. Again, VCC and their partners will need to really ramp up their collective voices to ensure services and programs are not cut in the wake of COVID-19. The other big consideration, which is completely outside of our control, but the economy continues to be a concern. And again, it is probably up to VCC and the MOA partners and the champions to build their collective efforts, the citywide efforts to reduce poverty. This is more important than ever, and I think will really need to be prioritized. I think in the strategy, we have the goals, the levers, and the principles. The levers, I think, are pretty pragmatic and pretty practical. It's easy to wrap our heads around what we mean by financial empowerment. We have some great momentum happening in that area. So it's easy to sort of mark and measure progress around the levers. The goals, I think, are big picture goals that our levers and our principles are leading us towards. So again, I think we can kind of get a sort of a real understanding of what those goals are meant to be and measure progress towards them. The principles are a little different, and I think that's a unique part of the strategy. And the principles came from our community voices that said, poverty reduction isn't just about income. It's about healing from trauma, and it's about grappling with really big picture issues that are very complex. And the principles guide how we do our work, not just what we're doing. So the levers and the goals help us think about what strategies are in place, what work are we doing, but the principles really guide how we do it. And they're about inclusivity, they're about valuing diversity, they're about shared leadership. These are a little harder to measure. And so I think it's really just about working with our champions and our community partners to keep the dialogue going around what do we mean by these principles and why are they important? And I do think they're really important because the how we do our work, is just as impactful as the what we do. So my two biggest concerns right now are mental health and learning and literacy. We've seen through research that the rates of mental health issues have skyrocketed, in some cases doubled or even tripled, particularly in young people. So this, coupled with disruptions in school and education, I worry that some kids have lost their connection to their teachers and to their school. And these two things could have really long lasting effects. So long after we've sort of figured out the public health or the health interventions for the pandemic, I think we're going to see issues related to mental health and learning and literacy for several years. And so our strategies, we need to recognize that this could take a while and that we need to continue to prioritize efforts in this area. Collective efforts to learn from these experiences must come from people, and solutions must come from lived experience experts. And I think this is going to be really critical as we move forward. Our partners are our experts. Their knowledge will be completely invaluable in the coming years to ensure we keep these issues at the forefront, but also develop responses and solutions that are grounded in real life and in the experiences of people who are living it every day. I think that the Enough for All strategy is more important than ever. I think the levers, the principles, the goals that we have in place are the right ones. I think we have what we need. We have a strong strategy that's grounded in what the community wanted and what our community needs. And so just continuing to move forward, prioritizing those levers, the goals and the principles, I think we can continue to make a difference. Regardless of the impact of the pandemic, all of the things in the strategy, I believe, are still relevant and still hold true in this new reality that we're living in.